Nursing Assistant Army Exam Date 2026. Question 1. A client is bleeding profusely from a wound. The nurse aide should: Option A, apply direct pressure to the wound. Option B, apply a tourniquet. Option C, elevate the wound. Option D, apply ice. The correct answer is option A. Apply direct pressure to the wound. Direct pressure with a sterile dressing is the first step to control severe bleeding. Tourniquets are for life-threatening bleeding not controlled by direct pressure. Elevation and ice are not as effective. Question 2. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 3. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 4. A client with dementia has difficulty eating. The nurse aide should: Option A, feed the client quickly to ensure adequate nutrition. Option B, allow plenty of time and provide cues to eat. Option C, puree all food to make it easier. Option D, skip meals when the client is resistant. The correct answer is option B, allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example, pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 5. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: Option A, 3 to 5 minutes. Option B, 5 to 8 minutes. Option C, 8 to 10 minutes. Option D, 10 to 12 minutes. The correct answer is option C, 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 6. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C, given a sedative. Option D, ignored until they calm down. The correct answer is option B, encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 7. A client with a pulse of 112 beats per minute is experiencing: Option A, normal heart rate. Option B, bradycardia. Option C, tachycardia. Option D, arrhythmia. The correct answer is option C, tachycardia. A heart rate above 100 beats per minute in an adult is tachycardia. This is above the normal range of 60 to 100. Bradycardia is a rate below 60. Arrhythmia refers to irregular rhythm, not rate. Tachycardia may indicate fever, pain, dehydration, or other conditions requiring reporting. Question 8. A client with dementia has a tendency to wander. The nurse aide should: Option A, place the client in a locked room. Option B, provide a safe wandering area. Option C, use restraints. Option D, ignore the behavior. The correct answer is option B, provide a safe wandering area. A safe, Enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 9. Which activity is most appropriate for a client with dementia? Option A. Complex puzzles. Option B. Simple folding tasks. Option C. Reading medical journals. Option D. Watching educational films. The correct answer is option B. Simple folding tasks. Simple, repetitive tasks like folding towels provide a sense of purpose and are appropriate for clients with dementia. Complex puzzles and medical journals are too challenging. Watching educational films may not be engaging. Question 10. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 11. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 12. A client is grieving the loss of their spouse. The nurse aide should: Option A. Tell them to move on and focus on their health. Option B. Listen and acknowledge their loss. Option C. Avoid mentioning the spouse to prevent sadness. Option D. Suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 13. When communicating with a client with dementia, the nurse aide should: Option A. Use complex medical terms. Option B. Use simple, one-step directions. Option C. Speak loudly. Option D. Ask open-ended questions. The correct answer is option B. Use simple, one-step directions. Simple, one-step directions, example, please sit down, are most effective. Complex terms, open-ended questions, and loud tones are overwhelming and may cause agitation. Question 14. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 15. When measuring blood pressure, the nurse aide should place the stethoscope over which artery? Option A. Radial artery. Option B. Brachial artery. Option C. Carotid artery. Option D. Femoral artery. The correct answer is option B. Brachial artery. The brachial artery, located in the antecubital fossa, inner elbow, is the site for auscultating Korokov sounds. The radial artery is used for pulse counts. The carotid and femoral arteries are not used for routine blood pressure. Question 16. Which of the following can cause an inaccurate pulse oximetry reading? Option A. Nail polish. Option B. Client holding their breath. Option C. Client sleeping. Option D. Client sitting up. The correct answer is option A. Nail polish. Nail polish, artificial nails, and dark pigmentation can interfere with pulse oximetry light transmission, causing inaccurate readings. While breath holding and sleeping can affect readings, They don't cause device inaccuracy. Sitting up is a normal position that does not affect accuracy. Question 17. When a client dies, the nurse aide should: Option A, leave the room immediately. Option B, provide post-mortem care. Option C, call the family. Option D, remove all personal belongings. The correct answer is option B, provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 18. The compression to ventilation ratio for adult CPR, single rescuer, is: Option A, 15:2. Option B, 30:2. Option C, 5:1. Option D, 10:1. The correct answer is option B, 30:2. For adult CPR by a single rescuer, the ratio is 30 compressions to 2 breaths. This is the American Heart Association standard for effective CPR with minimal interruption. Question 19. A client who is confused becomes agitated. The nurse aide should: Option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C, use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 20. The apical pulse is located at the: Option A, wrist. Option B, neck. Option C, apex of the heart, fifth intercostal space, midclavicular line. Option D, elbow. The correct answer is option C, apex of the heart, fifth intercostal space, midclavicular line. The apical pulse is at the point of maximal impulse, PMI, the fifth intercostal space at the midclavicular line on the left chest. The wrist is radial, neck is carotid, elbow is brachial. The apical pulse is counted with a stethoscope. Question 21. When providing oral care to an unconscious client, the nurse aide should: Option A, brush the teeth vigorously. Option B, use a sponge-tipped swab moistened with mouthwash. Option C, place the client on their side and swab gently. Option D, skip oral care for unconscious clients. The correct answer is option C, place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 22. When providing care to a client with dementia, the nurse aide should: Option A, maintain a consistent routine. Option B, change the routine daily. Option C, avoid eye contact. Option D, speak quickly. The correct answer is option A, maintain a consistent routine. A consistent routine provides structure and reduces confusion and anxiety. Changing the routine daily increases agitation. Avoidance of eye contact and speaking quickly are not therapeutic. Question 23. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 24. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, when the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 25. What does it mean when a client is placed on droplet precautions? Option A. The client must be in a negative pressure room. Option B. The nurse aide must wear an N95 respirator. Option C. The nurse aide must wear a surgical mask within 3 feet of the client. Option D. The client cannot leave the room. The correct answer is option C. The nurse aide must wear a surgical mask within 3 feet of the client. Droplet precautions are used for infections spread by respiratory droplets. These droplets travel up to 3 feet, so a mask is required within that distance. Negative pressure and N95 are for airborne precautions.